Hi there, everybody. This is Dr. Stephen DeQuino of Revivify Restorative Medicine, and today I'd like to speak with you all about PRP, or Platelet Rich Plasma. So here at Revivify, we specialize in, amongst other things, regenerative medicine. Regenerative medicine is the field of medicine where we're more concentrating on a person regenerating their own tissue, fixing a problem that exists, as opposed to covering up a problem with medications and things of that sort. And that's one of the tenets that is becoming more and more popular in medicine. Should have been a long time ago, but we really hang our hat on that here. So here at Revivify, one of the biggest things we want to do is get to the source of the issue. So let's say a person's having pain. So there's other ways to handle it than to just say, here, take this pain medication. Okay, pain medications can come in a lot of forms. You're thinking of like Tylenol, which is acetaminophen, Motrin, Advil, aspirin, which are all examples of NSAIDs, non-steroidal anti-inflammatories. And then we start getting further into it. We get into things like steroid injections, a cortisone injection into a knee or something of that sort. But the big picture thing here is what's causing the pain, okay? What's causing the dysfunction? What's causing me not to be able to do my job or do the activities that I want to do? And let's say that pain is caused by something like a torn rotator cuff, okay? One of the muscles inside the shoulder is frayed up a little bit and it's not working the right way or causing some issues. So my throwing an anti-inflammatory at you, great, it may relieve the pain, it may relieve the inflammation, but what we forget about is what are we doing about the tissue? Now, usually what will end up happening is the rotator cuff will get bad enough that eventually somebody needs a surgery. So somebody goes into the shoulder, they physically repair the tear, and then the person maybe get into physical therapy afterwards, and then eventually get back to near full function if they're lucky, until of course things go downhill again. One of the other things about surgery is that our bodies aren't really meant to have somebody tooling around inside the joint. So we want to be as minimally invasive as possible to go ahead and heal something and to avoid that surgery, because great, you may feel great for the next 10, 15 years or so, but after that, what comes next is arthritis. Okay, it's like I tell a lot of people, it's like the wheels on your car. If they get knocked out of alignment because somebody's messing around with them, what's going to happen to the tires? Eventually they're going to wear out a lot faster. So arthritis is wearing out of the joint after we've changed the mechanisms a little bit in a shoulder or in a knee or in a back or whatever. So with PRP, what I'm doing is I actually draw blood off of a person, take a normal blood draw off their arm, go ahead and pull out. It's a large 60 cc tube. So if you think some of the tubes that you're going to go ahead and draw blood off of for a blood test, for instance, are about 15 cc's. So you're looking at about 4 of those, or depending on the size, of course, sometimes 6 or so. But I'll draw off about 60 cc's of blood, spin it in a centrifuge a few times, and keep on taking off the top layers, which actually contain platelets. And platelets, besides what most people think of them doing, which is clotting blood, you get a cut, the platelets clot the blood so you don't bleed. They also are a very important part of restoring tissue. So as they do their clotting thing, they're also releasing a whole bunch of signals to other cells. And they're telling the other cells, hey, I need help here. We've got damage. Come help me fix it. And they're calling in all these reparative cells, including stem cells. So as those cells come in, they repair the damage that was caused. So I'm taking those out of a person's blood, preparing them, placing them back into another syringe, and then under ultrasound guidance, going in with the needle precisely to where the injury is, and injecting that platelet-rich plasma into that spot. And the idea behind it is I am putting the cells that will call the other cells in to go ahead and fix the problem, okay? So to heal the rotator cuff, or to heal the labrum, or to help with cartilage that's been degraded due to osteoarthritis, any kind of damage that, or muscle that's been torn, I'll put it into the tear. So one of the other things we don't think about is when we take things like anti-inflammatories, NSAIDs, ibuprofen, Motrin, Advil, at an acute injury, it can actually hurt us if we're taking too much of it, because what can happen besides the side effects of like stomach ulcers and kidney effects from things or liver effects from things like ibuprofen, Tylenol, we're also halting that inflammatory response because we're taking an anti-inflammatory. Well, the inflammation is the first step in healing. The inflammation is when all those cells are calling out with all those mediators, all those signals to the other cells to come on in and repair. So if we stop that in its tracks, what happens to the repair? Okay, so that's another thing we don't think a lot about. So here at Revivify, PRP is a great way to go ahead and do some regenerative medicine practices to help to heal an injury, either heal it faster or heal one that didn't heal the right way in the first place, or as something that you want to try before surgery, okay, to avoid the surgery altogether. So here at Revivify, we're happy to go ahead and offer that to you. We also offer other therapies such as perineural injection therapy, or PIT, otherwise called the liftoff technique, which is injections around nerves, cutaneous nerves that actually cause pain. In fact, I use it with my PRP to cause less pain. Also, we offer things like IV nutrient therapy, so to go ahead and do immune support, or metabolic support, or to support an athlete in recovery, or for chronic disease states, to go ahead and support the body so that they can function optimally. We also offer aesthetic medicine, because if you're feeling good, why not look as best as you can as well? So Botox fillers, lasers, chemical peels, microneedling. We even do PRP on the face. So a lot of different things that we have to offer. I'm trying to pull it all underneath one roof. So if you have anything that you wish to go ahead and speak with us about that you think we might be able to help you with, please feel free to give us a call here at Revivify Restorative Medicine. Our phone number is 858-429-0099. We're in North San Diego County in Rancho Bernardo. And you can always check us out on our website as well at www.revivifymed, so it's REVIVIFYMED.com, okay? All right, well, it's nice talking to everybody. I look forward to speaking with you all soon. And if you need us, of course, again, give us a call, 858-429-0099.